Carbohydrate counting for students with dietary needs. Things to consider in planning for a carbohydrate counting for a student. When carbohydrate counts are needed for a student with a chronic health condition, such as diabetes, it is important to review the needs of the individual student carefully. Carbohydrates, or carbs, are nutrients found in foods and are usually measured in grams per serving. Carbohydrates provide the body with glucose, which is converted to energy used to support bodily functions and physical activity. Foods that contain carbohydrates include breads, pizza, fruits, fruit juices, processed foods, dairy products, along with many others. If an order for carb counting for a student is received, a meeting with the family to discuss carb counting options is recommended. Sometimes the family will choose to be responsible for figuring carb counts of school-prepared meals. Sometimes the student's medical provider or nutritionist will want to be involved. Sometimes the school district or school nurse will assist in determining the carb counts for food items. Although the school's food service personnel may be involved in providing certain nutritional information, in most cases they are not experts in diabetes care, and therefore may be hesitant to provide exact grams of carbs in school-prepared meals. They are, however, responsible for providing labels, recipes, and planned serving sizes when needed. A collaborative approach to carb counting and management of mealtime is the best approach, using all the team members' strengths to come up with a safe and reasonable plan. Carbohydrate counting. There are several ways to determine the number of grams of carbohydrates in a food item. You can find the number of grams of carbohydrates by looking at the nutrition label of the food item. It is important to review the serving size on the nutrition label and to know how much of the serving size was actually eaten. If a student was served a different portion than indicated on the label or did not eat the complete serving size, then a calculation may be needed of what was actually eaten and the total number of grams adjusted. Some school food service directors use nutrient analysis to determine carb counts of menu items. Some will provide carb counts on the menus posted for families. Since this is not available in all districts, it is important to find out what is available in your district. There are also computer programs or nutrition books that can be used to calculate grams of carbohydrates in food items. Sometimes the number of grams of carbs will be listed on a cafeteria or food service menu. Again, calculating the serving portion may be needed based on the planned serving size, if the student did not eat the entire food item or if the student ate additional servings. It may be that the student's medical provider or dietitian will supply the family with the approximate number of grams of carbohydrates in usual or typical food items eaten on the menu, and suggest that these counts be used. Sometimes it may be necessary to review the district's food service packaging to calculate serving sizes and grams of carbohydrates. Self-serve items, such as salad bars, where students help themselves to fruits and salad dressings or other condiments, can sometimes make it difficult to calculate carbs eaten. Check with your school nurse to determine the best method for the student you are caring for. Blood glucose and carbohydrate counting. In most cases, the student with diabetes will need to test his or her blood glucose level before eating. Make sure to document the student's blood glucose level and place the result on any insulin dosing worksheet and/or log. Review the student's diabetes management plan to determine how to calculate any blood sugar correction dose. carbohydrate counting, and insulin dosing. For students with diabetes, the management plans should indicate whether the mealtime insulin dose should be given before eating or after eating. Review each student's diabetes management plan and discuss with the school nurse to determine what the plan of care will be for the student you are caring for. If you will be determining the required insulin dose based on grams of carbohydrates eaten, discuss with the school nurse what the procedure will be to determine the carb count. Will the student bring their food tray to you so you can determine how many carbs were eaten? Will you use a carb counting app or program to calculate how many grams of carbs were in the meal served, and then the student will tell you what they ate? Will you use the nutrition labels provided by food service to calculate the total grams of carbs? In most circumstances, the total number of carbohydrate grams eaten will be divided by a certain number, called the insulin to carb ratio, to find out how many units of insulin will be needed to cover the carbs eaten. This number may be placed on a mealtime worksheet to help in determining the number of total insulin units needed at mealtime. Procedure for carbohydrate counting and insulin dosing. Review the student's medication administration form, the medical provider order form, and the parent or guardian consent form. Check the student's blood glucose level and document the blood glucose reading in the appropriate places on any prescribed mealtime insulin dosing worksheet. If part of the student's order, calculate the number of units of insulin needed to correct the student's blood glucose level and place it on any insulin dosing worksheet. If the student is to receive his or her injection before eating, calculate the number of grams of carbs the student will be eating based on what the student states they will be eating, and place this number on any insulin dosing worksheet. After completing the student's individualized insulin dosing worksheet, give the student's needed dose and ensure the student is able to receive their meal in a timely manner. Instruct the student to return to see you if there are any changes to their mealtime menu. If the student receives his or her insulin after eating, the student's blood glucose level is taken before eating and is then documented in the appropriate places on any prescribed mealtime insulin dosing worksheet. If included in the student's order, calculate the number of units of insulin needed to correct the blood glucose level and place it on any insulin dosing worksheet. Once the student has finished eating, the student should return to the office, bringing their food tray or reporting to the nurse or office staff what they have eaten. A calculation of the number of grams of carbs eaten using the method that has been determined for this student is completed and recorded in the insulin worksheet. Appropriate mealtime insulin dosage is then given, and the dose is documented in the student's record. Carbohydrate counting for children with health conditions such as diabetes can be challenging. However, using all available resources and taking a team approach is the best method for success.